Dr. Kotiah, you graduated from the Jacobs School of Medicine and Biomedical Sciences at the University of Buffalo in 2004. So I have to ask, how'd you like Buffalo?
It was cold. I mean, being raised in the tropics, it was definitely a change. I remember I seeing snow for the first time when I was 10, and sort of being like fascinated by it. And then I quickly got over that. And I remember there was one summer, it was like June, and there was 14 or 15 inches of snow, and I didn't know which mound of snow was my car, and I had to go like brush off everybody's side of their car to figure out which car was my car. So to say that I think it was a wonderful place to learn and study, because you couldn't frolic too much or like go out and hang out by the beach. But I definitely don't miss those heavy drifts of snow for sure.
I wonder because our president and CEO, Dr. Main, is a fan of the Buffalo Bills. So did you get to see any Bills games while you were there?
I don't think so. I think Dr. Riseberg knows how lacking I am in the football knowledge
I've been
area.
to a Bills game up there with
But
Ravens.
was it cold?
It wasn't actually too bad that day.
Well, Dr. Riseberg, I understand you have a daughter who is studying public health, taking part in breast cancer research. How does that make you feel both as a doctor and as a father?
Well, it's really rewarding. I mean, she had been interested in science somewhat in high school, but was not interested in medicine. And then in college, she pursued a double major in math and then public health. And of course, she obviously was aware of my interest in oncology and breast cancer. And she was able to do a summer internship at the NCI, National Cancer Institute, where I had done my fellowship. So that was kind of cool. And, we would talk about her research, and she did some things that were related to breast cancer. And she's gone on to get her master's in public health, and now is getting her PhD in epidemiology with a focus in breast cancer. So it's really fun to talk to her about her research, and she actually wanted me to give her a little primer about breast cancer treatment, which was nice to sort of just impart some of my knowledge to her, and she's taught me things as well, because she obviously is looking at things from a very different side, and I'm hopeful that she'll be attending some conferences with me in the next year or two.
And Dr. Kotiah, you're a parent too, correct?
Yes.
Okay.
Yes.
What's it like trying to juggle being a parent and a doctor at the same time?
Not as hard as, I was very nervous. You can ask Dr. Riseberg. I was very nervous before he was born about, like, how's he going to survive the first 3 months? I don't have a handbook. I don't have instructions. And he said, you'll do fine. And he was right. You sort of survive that, that period of time where you get very little sleep and you feel like you're an intern again, and then you kind of get past it, and then you see him I have a son, he hits all these different milestones almost like every day, and it's very exciting. And I have to say my department, especially Dr. Riseberg, has been very supportive about my work hours and making sure that I don't work too hard and that I get home on time to spend time with my son. So that's been very helpful.
I understand that you're a cat lover. You supported the efforts of the Show Your Soft Side Pet Protection and Advocacy Group.
Oh, yeah. I don't know how you know about that, but yes.
We do our research here at Medoscopy.
I'm an animal lover, I would say.
Okay,
yeah.
well, you must have some interest in cats.
Yes, I have two. I have two of them.
Okay, your fur babies along with your human babies, right?
Yes, exactly.
Okay. What about you, doctor? Do you have any pets, or you?
Yeah, we've had a couple of dogs. We have a dog that we got actually the day of the shutdown when the pandemic started, and then it became very popular to get dogs. He was a rescue that I guess my wife had heard about through a friend, and we had the other dog at the time, and so we adopted Sonny, and then our older, smaller dog Bailey bossed him around, but then Bailey went on to dog heaven, and Sonny has taken over. But it certainly has been a nice companion, particularly for my wife, but also for myself to have.
I can't help but wonder, since you're both doctors, if your pet ever got sick, did you try to cure them yourselves? Like, let me see if I can apply my medical knowledge to this cat
Oh no,
or
I mean, I
dog.
try to stay in my lane, and in fact, I was fortunate enough that my two cats that I had before passed away at like 19 and 16 years old. But my 16-year-old, he had a seizure, and it was horrifying. And I took him to the ER, and the doctor wanted to do all this testing and scan his brain, and I just knew it was his time. So it was very heartbreaking for me, but I held him as they, put him to sleep. But I still am at peace with that decision, even though I hurt over it. But, I think because of what we do, we try to be more, in tune with the balance between quality of life and going through treatment. I think we've talked about this before. There are certain things that we would not go through because of what we've seen with the patients. There are certain things that we would be happy to go through because we know that the risk versus benefit ratio is, favorable in terms of benefit. So it just depends on the situation. But I certainly think that my outlook in life has been not to do everything all the time, but I try to be very grateful when I wake up and I'm healthy. And every year that passes, every birthday that passes that I haven't had a major medical problem, I'm very grateful for that because I can't take that for granted. And that's one of the things that my patients have taught me, I think.
Yeah, I would completely agree with that. You definitely get a perspective being in this field that you don't sweat the little things as much. And you see what some of these people go through many of whom are now much younger than I am. I mean, now I have patients on chemotherapy who are, the age of my children, which is, very scary. And you just see things that make you really appreciate life.
I know you've done a lot of work with Maggie Koderka, the bald ballerina. Do you really? How is she doing, if I may ask?
I mean, she's doing okay. She's doing well. She's still receiving treatment, and I know she's very open about her.
Yes, she posts. I follow her, and so every time I see her post, I repost them. Her last reports were good, from what I remember her for posting. So, I mean,
She's been an inspiration. I mean, I met her at a young age, and she obviously took the mantle of a young woman with a bad disease, and rather than sort of crawl into a corner, she has really sought to educate and be a model for so many other young women.
We'll take another break and come back for our final segment of Medoscopy.
If you know this song, sing along with me. Just wanna, everybody sing this, go. Just wanna praise you forever and ever and ever.
First and foremost, I gotta thank God. I thank God for all of the doctors that I had. Dr. Jacobs was my hope. When I gave up, she said, no, you will not.
This is really one of the most moving days of the year for me as an oncologist because I get to see my patients who are celebrating where they are and going through this tough process.
As a caregiver, we understand and we feel what family members and their patients, their loved ones are going through.
The war against cancer is beyond just medicine and modern drugs. It's about the strength of the patients with cancer and the strength and the support by the family members.
Coming here representing how I take care of my father and take care of my patients here is a time to celebrate these survivors that have gone through that rough journey of cancer treatment.
Mercy is the right name for this hospital. That's all I'm gonna say.
It really is a great feeling when you can see someone that you know that they're doing well because of a new treatment that wasn't available in the past. And sometimes they're treatments that we even were involved with at Mercy in researching.
Be confident in your healthcare team. The oncologists, nurses, and staff here at Mercy will take absolute amazing care of their loved ones.
It's really invaluable to be able to work and celebrate and share the experience of the journey with the patients and their family members and their loved ones.
And I just pray that everybody that's going through cancer, who's made it through cancer, just keep your light shining. Because like I said, you never know when you might be the one that'll help somebody through it.
Thank you for protection. Thank you, dear. Thank you. I want to thank you for your
As viewers know, one of the regular features of our program is a sort of show and tell, where our guests bring in something, some item, could be a book, could be a photograph, but something that in some way is symbolic of who they are and what they're about. Dr. Kotiah, I'm going to start with you. What do you got for us today?
So I have this bobblehead that a patient made for me many years ago. I would say it was about 8 years ago. And it was a young woman who had breast cancer. She was a nurse at Hopkins. And she was very, very inspiring. And ultimately, she succumbed to her disease. But what struck me about her, and I still remember her name, her face, everything to this day, was how full of life she was, despite the fact that she was fighting a really horrible disease. And, there's that saying that you could live, to 90 years old and never really live your life, or live to like 30 and really enjoy every aspect of it. And she reminds me of that. So every time I see this bobblehead, because it's sitting on my desk, I think about her and the lesson that she taught me. So it's really special to me, not just because it looks like me.
Dr. Riseberg, what do you have for us?
So what I have is a receipt for 1 ounce of worm tea that was prescribed to Isaac Thompson in Philadelphia in 1834 by some physician, presumably. Or this was a receipt, but in any case, it was given to me by a patient who, I also remember fondly. But I think to me, when I look at this, I think about how important doctors have been, not just recently when we have all this technology and we have hospitals, but back in the day when doctors went around carrying black bags and didn't have a lot of good treatment options. But the relationships were probably even stronger perhaps than what we have now, because there weren't that many doctors and they did so many different things. And so I'm sure that this 1 ounce of worm tea that went to Mr. Thompson meant a lot to him. Whether it did anything, I don't know. But I think it to me, this sort of just lets me know, how important doctors have been across the decades and centuries, and and how important that relationship with the patient is.
Is there a life lesson in your work in medicine that you've taken away from your time treating patients, something that you apply to life in general?
To me, it's what I said earlier: don't sweat the small things.
Yeah, it's sort of reiterating what we said earlier, which is like, appreciate your health, appreciate your life, live it fully, and don't get caught up in small things, because it will just rob you of joy. So just do what you can, because we never know when our time is up. We're not meant to know those things. So if you can do your best to, because there's always going to be stress, but let go of the bad things and hold on to the good things so that you can enjoy your life more, because that's how I feel like you win at life. You win at life by choosing to be happy as much as possible.
Dr. Riseberg, Dr. Kotiah, thank you both for your time and candor. I'm hoping our viewers enjoyed an opportunity to get a little up close and personal with the two of you, and perhaps learn something that they can apply to their own lives. And thank you for watching. On behalf of myself, our guests, the Mercy staff, and the Sisters of Mercy, we wish you good health and humor. And until we meet again, may the road rise up to meet you. Patients may have to wait many weeks or even months to see a specialist, and they come in and they're overwhelmed and all this is going on, and they've been taken here and taken there and done tests and everything else, and suddenly they're in their car driving home and they go, "Oh, I can't believe I forgot to ask the doctor this important question." So my question to you is, what is that palm to the forehead question that you hear from patients? Or another way to put it, what question do you wish they would ask but don't? and you would like them to?
To me, the one thing that always seems to come up when you're walking out the door is that, oh, I've been having some crushing chest pain, which then, of course, changes the tenor of the visit. As far as what I think patients should ask, I think they sometimes are afraid to ask, about their prognosis. Some do, some don't, and I think it's important for patients to have a recognition, not of the details. Do I have 6 months to live, a year? I don't know, and I can't give people exact percentages. But what's the general picture? Is this something that they're probably going to do okay from, or is this something that's probably not going to end well? And so I think that it's important for patients to leave the office with an understanding of the big picture.
No, I mean, I agree with that. I think that is, but that's also challenging in many ways because it depends on the person's cultural background, their education level, how much denial they're in. So, it's more complex. I mean, it requires like sometimes multiple conversations, and even then, sometimes we don't always make headway. But I think that's important for us because, we always want to help. But if the patients are on the same page as us about the goals and where we're going, it's always helpful. But I think a lot of the times patients ask good questions about financial impact of their treatment, how they can get help with that, and impact on their family, how their family can get help. But they ask questions about diet and how they can change things in terms of their lifestyle. And then on top of, like Dr. Riseberg said, one of the interesting things or the most important things about being an oncologist is that you treat the whole person and sometimes their family. You're not just treating their cancer, right? So you have to kind of think about all the things that will impact them as you're trying to help them, because that will take away from their treatment if you don't help them with the other things. And one of the things that I think, especially under his leadership, that has happened a lot is we've had a lot more help than we used to. We have nurse navigators, we have nurse practitioners, we have social workers, we have nutritionists, we have palliative care folks. Like, we have all kinds of support systems in place to help patients with all the other aspects, not just this is the chemotherapy plan for your cancer, this is the immunotherapy plan for your cancer, but this is you as a person and how can we help every part of you.